Thank you. I'll wait for the slides to go up as well. Greetings, everyone. It's a pleasure to be here with you, and I want to commend the work of the task force and your contributions already to the psychosocial spiritual healing for our people simply in your listening sessions. Can you move to the second slide, please? I just want to locate myself in this conversation. I want to give a lot of gratitude as well to my dear colleague in this work, Dr. Enola Aird, for the opening she just brought and for the wisdom that's following me for the rest of this panel discussion. These are esteemed colleagues who will go into a deeper dive into various aspects of delineating, once again, what we all know to be true, the impact of the lie, or more specifically, what I would say is what is due to us when you think about psychological reparations, because it's not just these institutions and what happened for us in terms of disparities with finances. It is a psycho-spiritual, multi-generational woundedness that we have had to contend with and are still contending with in various places and ways. So in my conversation, I'd like to invite the task force to step into what Enola shared in terms of this audacious and creative solutions to go beyond just deciding or considering who's due what financial compensation, but how do you leverage your authority in this decision making in this historical moment to actually target the systems that continue to do harm to our people from a psychological, emotional, spiritual place. And I hope as you hear my conversation that you will hear some concrete, tangible, short-term and long-term aspirational goals. First, let me say, too, I want to appreciate some of the comments that came before me, particularly when people were talking about the need to hear more from folks within California. So I want to locate myself again, though that I'm in Maryland right now. My entire professional career was, in fact, in California, in the Bay Area for about 35, 40 years. So that is where I was brought up and raised by the clients and populations that I worked with, both at Children's Hospital Oakland, which is now called UCSF Benioff Children's, as well as the community folks who are struggling with what is typically called mental illness, and also growing up within the bosom of the Bay Area chapter. So though I'm here in Maryland, I still consider myself bicoastal, and I hope that becomes clear and evident as I contribute to this conversation as well. So next slide, please. So first and foremost, when we think about trauma, which has been a very prolific term for us now, we know its meaning that something abnormal is happening to someone, and it can lead to lots of dysregulation, physical changes, psychological, spiritual changes. But I want to put this in deeper context, looking at the moment that we're sitting in now, at the nexus of the COVID and the heightened attention around racial trauma. You know, the COVID set the entire world down and pulled back the curtain on this long-standing, ongoing, persistent issue within our communities, where we have gone through times where folks are trying to make us think we really lost our mind by saying that we're post-racial, or the mental health field professionals would say that when clients are presenting with concern, when Black clients present and they say they're feeling a certain kind of way when they walk through a store, or feeling like in their work setting they're being treated differently because they're Black, good intentioned mental health providers have also been known to label that as irrational thinking, a sense of paranoia, and begin to proceed that way. So in other words, they're contributing to this dis-ease that we're dealing with. And I offer these images as well when we talk about the evidence that we're still going through this. So again, in our post-racial society, there's such a preoccupation with the residuals of enslavement that even when good intended white feminists are wanting to protest their right to not be locked down for COVID, why are they pulling up an image, a Black image of a person who was formerly enslaved as their evidence that they're not slaves and they need to be free? Again, when the January 6th election happened, again, the image, why are we seeing the noose once again? So these are all the messaging, the psychological residuals, the ongoing psychological torment and terrorism that our folks have been exposed to. Next slide, please. So to be clear, this type of trauma has touched all persons of African ancestry, particularly those that we've been speaking about here in terms of freedmen within the United States, they just may be in various places in terms of how they are reacting or coping with those stressors. Some of us have a certain level of psychological awareness, so we're able to sort of name what's happening to us and able to access resources in terms of family, friends, and even a good mental health provider if that's available to them. But there are many of us who are still unaware because we bought into the lie, once again, that everything is individual. So there must be something wrong with me. So they're taking all of this in and they're reacting from that. And this is what's emerging most times for what is called mental health illness or severe mental health illness here in the United States. Because I would say we need to be very curious and critically question and wonder how much of what's being presented is actually a manifestation of the ongoing complex trauma, racial stress that we are exposed to versus someone's Western theoretical individuation of pathology located in the person. These terminologies I offer here for our readers to take in as I'm sharing this, but I also want to honor and take in some of the work by a psychologist from the First Nations, Braveheart, who talks about soul wounds. What we call multi-generational trauma, which passes down from one to the next. And this is not necessarily a verbal passing down. I don't have to sit my children down and talk with them about racism so explicitly. However, they can still feel it in the nurturance of how they're being raised up. If I am not conscious as the mother of the psychological implications of racism in terms of how my children can be disenfranchised in school settings, the worriness of being safe coming home with the interface with law enforcement. If I'm not aware of that, and I'm really buying into everything is fine and we're post-racial and everything's equal here, then I'm leaving them at a psychological disadvantage when certain atrocities show up and they end up internalizing that. I also want to underscore here too this idea of collective trauma. Once again, I may not have to experience my child being murdered in order to feel the pain and the risk of my child being murdered simply because of the color of their skin and because of someone else's pathology. I'll just name it that way. So there is a collective trauma for us. I think this also shows up for many generations of Blacks. If we say when something happens, we're like, okay, were they Black? And we take a sort of an exhaling if there wasn't someone Black who just did that major crime, because we feel that deeply. Also, when we talk about the atrocities during the time of enslavement, they happened in the past, but they're still living in our DNA and our spirit and in us. So we still feel it as well too. So I would submit to you the murder of Brother Floyd and Brother Ahmed and others who've been named even recently reawakens the psychological trauma and pain of all those who were unnamed and taken from us to all the ones that we can name, have lost their name, but still feel the essence of them within us. So this is important because it's also laying the foundation, the realization that the systems that are designed to help alleviate such mental illness, if you will, or psychosocial or psychospiritual woundedness are not prepared to do so. At minimal, they are actually part of the problem. I want to underscore the beautiful title of the California Reducing Disparities project that was done in 2012, where it was when you're looking at the experiences of Black Californians in the mental health issue, they aptly so named that piece, "We're not crazy, we're just in systems that are crazy." So this is important. Next slide, please. So many of the Western systems predominantly are still very much preoccupied with individuation or the individual level of what's happening. But systems of oppression, and more specifically, systems of structural racism, is in fact the dis-ease that has roots for many of our behavioral mental health, psychological, or otherwise. And it does, in fact, not only involve these messages, but as my dear colleague Enola Eyre just explicated, they are the roots that feeds that type of thinking. This is how the lie manifests itself. So we want to hold on to this and that level of importance as we continue this conversation, because it also speaks to things like use of language. This is important to me all the time, because when we say children who are at risk, then it focuses all of the attention on fixing the child. The funding goes there. It's the evidence for pulling a child out of a class and placing them in individual therapy without their families knowing. And this is one of the things that still happens in California that I'm very much aware of, in other issues. But if we ask ourselves, if we can shift that and say our children are at potential in at-risk environments, then the question becomes, what happened to them? What's going on in their environments? And this too is where I'm asking the task force to be curious about how you can leverage your positionality in increasing and impacting the environments in which our youth and families are growing up in as part of their healing process, as that too would go a long way. This is also important when I think about, excuse me, I'm just having a little dry cough here a little bit. Hold on. This is also important when I think about the storiedness that Miss Mims shared early, and I want to appreciate her for her courage in bringing her story forward, because I think it's a good example of our institutions not understanding the depth and woundedness of this type of psychological stress and how it shows up. And it too deserves the same valid attention, resources, and time off as any other illness, if you will, because most of what shows up as depression, anxiety, obsession, behavior, whatever those diagnostic labels are, I still submit that many of them have their roots in this unresolved trauma that we can continue to contend with. So there's a proverb that says, the lion and sheep may lie together, but the sheep won't get any sleep. I want to offer that in the sense that those Black psychologists and mental health providers who's been doing this work, there's no sleep for us. There's no sleep for the people who are in the grassroots, in the trenches, who have really been, and many of them you've heard on the call today and previously, many of these organizations and grassroots leadership that comes forward and they're doing the work behind the scene and for the people while still having to contend with their own exposure to this type of trauma. So Black exhaustion is extremely complex and it's real. Next slide, please. So the psychological literature will talk about when you're dealing or working within trauma and coming from a trauma-informed care approach, it's really important to produce realignment after trauma. I beg the question, how can there be realignment after trauma when the trauma has not stopped? And that's the question we need to be asking critically. Again, language is important. There's a prevalence around the importance of resilience, our capacity to bounce back. And I completely get that and concur with it. And yet, at the same time, it can be weaponized against us because there's an overemphasis, almost glorifying our capacity to bounce back, as opposed to saying what's going on they have to bounce back from and how do we stop that. So here, once again, I want to underscore as an opportunity for the task force to listen critically to the conversations coming through with my colleagues today and others. How can you leverage this in California to stop the madness, to get the knee off the neck, so we do not have to continue to be resilient, but have a right to live a whole, well, psychological, spiritual, physical, economical life. And again, when we think about the trauma, it talks about shifting the language from what happened to you, i.e. pathology, what's wrong with you, to, from what's wrong with you to what happened to you. So please allow me that correction. So this is what I'm saying. Mental health services, providers, there has to be an accountability for their addressing the issues of what happened to whomever they're serving and how their services will meet and address those issues and move away from simply promoting symptom reduction and be more intentional about quality of life change. Next slide, please. So I bring these next two slides up just to be very clear about this very historical moment that we're sitting in right now. I submit to you there's a sort of a crack in the system that I think it's crucial for us and for the task force to leverage the conversations that you're listening to help transform the field of mental health services. Because as this statement is showing, the American Psychiatric Association named out loud and said very loud and clearly that it too has been working from structural racism, naming all the atrocities that many of us have known to be true about the disproportionate services for people of African ancestry, African descent, where they're more likely to be pathologized, diagnosed with diagnoses like schizophrenia and others. They're more likely to be over-medicated, under-medicated, simply because of bias, implicit bias, and structural racism within the system as opposed to what's needed for them uniquely. And we see this because the literature has clearly demonstrated the evidence of the differences in treatment when everything else is held the same and ethnicity and or class are the variables that bring this forward. I want to read to you a quote that stands out for me quite a bit. You know, historically, psychology has accepted whiteness as a standard or norm and presented other modes of being as marginal, unnatural, or in some way straying from the norm. This is what is being apologized for. However, it's not enough. Next slide, please. It's not enough because, again, if we look at the apology and the energy that's going on now within the American Psychological Association, where they have posted their own apology. I was actually part of the work group that was tasked with delineating the chronological history of all the damages that were done to communities of color. And I strongly encourage the task force, if you have not, to look at that document. But I also want to say, too, this is all still incomplete and insufficient. Though I'm pleased I was part of it, but there's still systemic issues that gets in the way of bringing about genuine change and recognize this because the system is actually broken. Right? It is, in some ways, it's doing what it was intended to do. It just like the history of law enforcement in this country, the history of mental health was actually designed to strategically pull out and disenfranchise certain groups like Black folks. So I like to say it's that the psychology and the mental health services that we have now are drawing from what I would call a poisonous well. That the hegemony, the roots of how it was designed is still bearing fruit in how we practice today. And so therefore the institution itself cannot be solely responsible for changing itself. It does need outside viewers, outside folks like the task force, critically looking at its role in this work. Let me just share one other quote for you as well, please, that stands out for me that I think feels relevant here, which is the report, the California report, the California Disparities Report is prominent for me too because it strategically looks at the voices of the people. What are they saying about their mental health? And as opposed to listening to established systems. So though APA, both these psychological associations and American Psychiatric have started this, it is not their work to do and finish. It is ours to do. Next slide, please. And what I mean by drawing from the poisonous well, one of our callers earlier referenced this diagnostic space. But this is what we mean by the residuals. They're still sitting here. This was what was determined to be a mental health issue, is the preponderance of enslaved Black persons to run away from enslavement, we diagnosed as pathology and prescribed the cure. And its residuals, this shows up here, is the myth that is a cultural value for Black families to beat their children, when it is actually a social adaptive phenomena based on these 300 plus years of this type of behavior that we were socialized into. So we wish to note that treating perceived racism at the individual level not only applies a proverbial bandage on the insidious problem, but also further burdens the victim. The systems that may serve as the source of the discrimination should be aggressively targeted. From a systemic standpoint, medical and academic institutions alike can raise awareness of the negative impact of racial discrimination, systemic racism, and health disparities through didactics and trainings focused on diversity, cultural awareness, and sensitivity. But more specifically, the ones who are leading those discourse must be the people themselves. We must hear from our own communities. That needs to be central and privileged, as opposed to professionals coming in and saying, here's what we're going to do to fix you. We have to strategically listen to their voices. And I want to, again, underscore the work with the Community Healing Network, because the Emotional Emancipation Circles is a beautiful example of what health and healing can look like for our people, because it goes beyond simply formal therapy, if you will, because not every therapy is therapeutic, and not everything that's therapeutic is therapy. And as I alluded to earlier, and we'll say more explicitly as we go through this talk, many of those who are trained to help in the mental health profession are ill prepared, miseducated, and some are very intentional about their racist thoughts and attitudes about our people. And so when we present with certain symptomatology, if you will, or a context, we're led to believe that the problem is us, and not given a space to really look at what's happening to us, and then also to critically review how internalized racism is impacting us and how we interact with ourselves, one another as well. So next slide, please. So what we're really calling for, and what we really need, is a genuine transformation of the mental health field. And I would be remiss if I did not honor and raise up the work of Black psychologists, particularly those who are the founders and members of the Association of Black Psychologists, and as well as other Black organizations like the National Association of Black Social Workers, Black Psychiatrists of America, Black nurses, and the list goes on. What I'm wanting to underscore with this particular slide here is raising up the fact that these organizations have been doing the work together and individual within their own disciplines, yet we've been at a disadvantage because small in numbers, limited resources, and the systemic supremacy and domination of organizations like the American Psychological Association and the American Psychiatric silences this work. So again, I would like to suggest to the task force that you are very intentional to continue to invite to these conversations members of these various groups, particularly those who are working within California. And I'm going to give, of course, a huge shout out for the Bay Area chapter, as well as our up and coming Sacramento chapter for the Association of Black Psychologists. And we have other chapters throughout. Just being able to help leverage the work that they're doing at a higher level is a valuable way to dealing with the psychological reparations of the enslavement Mayat. Can we go to the next slide, please? Because one of its primary gifts is shifting how we think about trauma, how we think about illness. And I want to lift up the work of Marimba Ani, Dr. Ani, who talks about conceptualizing what happened to us in this idea of an African trauma cycle, where prior to the slave trade, prior to the trafficking of Black bodies, prior to the genocide, the direct intention of genocide and trauma to Black bodies, there was a period of wholeness for us within the African continent. It's our way of being in the world. We still had our own struggles, but they were ours to contend with. The Ma'afa is this time of the enslavement, and we are actively in what we want to call the Sankofa space, where we must do our own healing. We must be the drivers of our own healing. We must be heard in our own. It's not to disenfranchise anyone else, but to center us. We have gone through this. We know what's happening, and we have the tools to address this, particularly within the Association of Black Psychologists, other Black scholars across the groups I just spoke to. So this is the leverage that we want to say as we go to the next slide, please.
Ms. Jackson, can you wrap up?
Yes,
wrap up the comment.
Absolutely. Okay, so many of the scholars, these are unsung scholars who paved the way. This is just a short list. There's many, many more. These are the types of criteria that can be used for what reparations will look like. Next slide, please. And I list these here. We can go to the next one too, just for the visual representation. The scholarship is here. It just needs to be taken into a deeper dive of application. You know, how do we require mental health professions to be accountable to us and our people, both in terms of funding at the federal and state level with guidelines? How do we be very clear about lifting up the work that's already been done that's effective, but it needs to be researched and further applied at a greater level beyond the limited resources that we have. The therapist in residency program that comes out of the Bay Area chapter is a perfect example where it was very intentional in how do you train Black clinicians to provide Black psychology therapeutic services within the Black community. The feedback, just like with the EECs, well received within the communities, but again, we need more resources to expand it out. How do we build further on community-defined practices, listening to our folks, lifting up that work, centering it as we bring in other sciences, and then strategically dismantling racism and mental health services. Next slide, please. I'm going to move through very quickly. I do want to take just the last couple of minutes to really underscore this particular population as we look at the interplay between those who live with sickle cell disease, which is a chronic illness, and its implications for Blackness as well. Next slide, please. So sickle cell disease is a inherited blood disorder that both parents, of course, need to, at minimal, have trait, which means they don't have the disease, but they have the capacity to pass it on, or you can have one parent who has the disease and one parent with trait. And this is a debilitating disease that has been going on for centuries. However, here in the United States, it continues to be underserved, under-researched, and underappreciated given the complexities of the illness. Next slide, please. And it's a very multifactored, very complex disease that requires intense treatment and care, and yet it is the least attended to, if you will. And pain is one of the primary criterion here in the way in which the structural racism shows up is the disenfranchisement where professionals do not want to work with patients who have sickle cell disease. I've witnessed where nurses would draw straws, and whoever has the shortest straw is the one who's going to serve the patients with sickle cell disease. I've witnessed many times where they're referred to as sicklers, or they're being accused of fiending, that they're in pain, even accused of wanting to have a psychosocial admission because of their wanting to be drug seeking. Next slide, please. The prevalence is real. This is here. I just want to bring attention to the work that was happening in California and how to expand it further. It is important that we bring back the comprehensive care centers to better serve this population across the lifespan. You can see that there are emerging populations who are being diagnosed with sickle cell disease, but the primary group is still people of African ancestry, and which leaves them again to the implicit bias within the healthcare industry. Next slide, please. And again, honoring the work of the Black Panthers within California who knew this then. And so we're still in the same conversation of how to increase the awareness and both within our community so we can make sure we understand our status, make informed decisions about reproduction, but more importantly about the quality of services that we receive and also the care that's needed in terms of the training for the medical professionals. Next slide, please. So the healthcare disparities are real, as I've sort of tapped into a few of them. The ways in which they also show up too is that there are too many medical professionals and nurses who've only had, if anything, a page or two in their training around sickle cell disease. They're not used to working with such a patient. And so then when they show with sickle cell disease and they have a Black face, they are least likely to care for them and they're more likely to present in all the healthcare disparities and implicit bias and structural racism that's well documented within the field. Next slide, I'm almost done, I promise. So in terms of reparations, when thinking about this particular group, and it flows from the previous ones, is partnering with the grassroots organizations, again, that are doing the work, giving a shout out for the Cayenne Wellness Group in Southern California, also the Sickle Cell Advisory Council in the Northern California under the leadership of Wanda Payton, and being able to, because they've put together a 10-point plan of how to dismantle some of the racism, structural racism experienced by patients in the ER. The task force should definitely invite them in to learn more about that. I've sent you the document to look at more closely. As noted here as well, the California Children's Services Standards was written in 1977. It has not been updated. It desperately needs to. There's a disparity in terms of how insurance is done, where those who are on public assistance have very limited access. Those who are in private also have limited access. So we have to close the gap in terms of being able to ensure that all patients, all people living with sickle cell disease, who we call champions, have full access to good quality medical care, as well as access to what we call complementary alternative medicine pieces in their work. And next slide, please. And so as I close, and I want to thank you for this moment, my apologies for going over time, but I welcome questions. But at the end, I just really, as I said, want to lay the foundation, the context for the task force to continue to be bold and courageous and think more diversely in terms of how to leverage reparations and helping to target the systems that continue to perpetuate psychological, spiritual, emotional challenges within our people. Thank you.